This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Supposed to
help first or
Medical Dilemma.
Hi, I'm Sunny Del Rosario and you're tuned in to Medical Dilemma. In the scene of a murder, DNA samples could be taken and examined to identify the criminal. When a case of sexual assault is reported, the same technique may lead to the arrest of the assailant. As to whether a child was indeed fostered by an alleged parent, DNA testing could settle the debate. In this episode, we'll look at DNA examination and other practices that help answer the question, who did it? With me for the first segment is Dr. Demetrio Valle Jr., an anatomic and clinical pathologist, head of molecular pathology of Makati Medical Center, and medical specialist 2 at the Hospital ng Makati. Welcome to the show, Dr. Valle.
Thank you for inviting me here.
Okay, Dr. Valle, for the sake of our viewers, let's first talk about topics that are more informative in nature. So maybe the first thing you should tell us is your background, your professional practice itself.
Okay, I'm a pathologist. A pathologist is a doctor of medicine who specializes on the diagnosis of the diseases from blood, body fluids, and tissues. Normally, in the Philippines, the pathologists are the head of the laboratories, clinical laboratories, and we work together with medical technologists.
Okay. Now, these diseases that you mentioned earlier, what are they or what are the types?
Okay, it can, from the tissue, we can diagnose if the tissue is cancerous or not. So we can diagnose cancer. Also from the blood, if there is an infection, or if there is a leukemia. In the urine, if there is also infection. So all tissues or fluids accepted in the lab. So we analyze these samples and together with our medical technologists.
Now, what are the current technologies or new developments in technologies used in the laboratory these days?
The current technique or the diagnostic technique now is the molecular diagnostic, which is the laboratory medicine with the aid of the technique of molecular genetics. And the molecular technique or the molecular diagnostic has a higher sensitivity and specificity in terms of the diagnosis of a certain bacteria. It can also classify and subclassify bacteria. Also, molecular diagnostic can help in terms of the prognosis and also targeted therapy for certain diseases.
Could you give us an example of a condition that is helped by your practice?
Like for example, the lung cancer. Lung cancer, if it's a adenocarcinoma, there's a specific treatment that can help, that can improve the patient's condition. And with the help of EGFR testing, we can, if there's a mutation in the EGFR gene, it is beneficial for the patient for a certain treatment. Thus, the molecular diagnostic can help the prognosis of a certain patient. And also, like for example, for the HIV, HIV viral load, wherein the HIV viral load can help the value of the HIV viral load can predict if the patient is responsive or responding to the treatment for the antiviral treatment.
I see. Now, aside from studying these bacteria and other kinds of microbes in the blood or in the fluids or tissues, what are the other applications of such technologies?
One of the most important or significant contribution of the molecular diagnostic is in terms of DNA paternity testing.
Paternity testing.
Yes, yes.
Okay.
DNA, as we all know, is the major component of the chromosome, and we have 23 pairs of chromosome. And with this, the DNA not only control the different processes of our body, but this very important marker, our genetic makeup. So it is very sensitive tool in terms of the probability of paternity. So you have 99.9%. We can be sure if the child is if the father is the real father of a certain child.
What exactly in the results can you see to make you conclude that a child is indeed the child of a particular parent?
Okay, in DNA paternity testing, we're using what you call the STR analysis, or short
STR
tandem
analysis.
repeats. It is we have 16 markers actually. Right now we're using 16 markers. And these 16 markers can able to identify the profile of the father and the profile of a child, and the profile, the one half allele, one half marker or allele of the child should came from the father. So we are very, very sure that the father is, or the alleged father is the real father or not.
So in other words, you're supposed to compare one half of the child's markers,
yes, markers
with the markers
with
of
the father, and also the one half coming from the mother,
and the one half coming from the
mother.
And so if those match,
you are very,
are
very sure, about
very
99.5%.
99.5%.
Possibility that we're dealing with the real father or not.
And have there been cases where the results were actually wrong or inconclusive?
Okay, there's if we have doubts or equivocal results, we can have add another marker, or like for example, Y chromosome analysis. So we can add more markers from the to add for the 16 markers.
What's the difference between the first 16 and this next marker?
If you have really a doubt or equivocal results, but usually the 16 markers are enough to diagnose or to distinguish the real father.
I see. Okay, thank you so much, Dr. Valle, for the information. We'll have to take a break for just a few words from our sponsors. We'll be right back.
about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?